Hacek endocarditis. So, Hacek is a group which is highly fastidious, slow growing, capnophilic gram negative bacteria are present. So, what are those? They are gram negative bacteria. These Hacek organisms they normally reside in the oral cavity as commensals. Occasionally, they are also associated with local infections. Local infections are caused in mouth, whereas the systemic infections most commonly caused is bacterial endocarditis. The species present in the group are Haemophilus parainfluenzae, Aggregatibacter species. Aggregatibacter species, most commonly they are Aggregatibacter actinomycetum comitans, Aggregatibacter afrophilus, Aggregatibacter parafrophilus. Next, it is Cardiobacterium hominis. Next, Echinella corrodens, and finally Kingella kingae. To be noted, the Hacek endocarditis they cause endocarditis, which is 3% of the total infective endocarditis cases. They are 3% of the total infective endocarditis cases. And the course of the disease progression is typically it is a subacute course. So patients who are vulnerable are the patients who have pre-existing valvular defects. The patients vulnerable are the ones who have pre-existing valvular defects or who are undergoing dental procedures. Most commonly affected valves are aortic valve, and mitral valve. Finally, coming to clinical features, this is the short form which I kept for Haemophilus parainfluenzae. So it is a commensal in mouth and throat. Occasionally, it becomes opportunistic, where it causes endocarditis, abscesses, conjunctivitis, genital tract infections, and bronchopulmonary infections in patients having cystic fibrosis. And the growth to identify between the Haemophilus influenzae and Haemophilus parainfluenzae, we check for the growth requirement, where the Haemophilus parainfluenzae requires only factor V, not factor X. Also, we can differentiate Haemophilus influenzae and Haemophilus parainfluenzae by using automated systems such as Malditoff or Vitek. Coming to Aggregatibacter actinomycetum comitans, which is formerly known as Actinobacillus. So, formerly known as what? Formerly known as Actinobacillus actinomycetum comitans. So, it is the most common member of Hacek endocarditis. It is isolated from soft tissue infections and abscesses which are associated with actinomyces israeli. So, the organism is isolated from the infections of soft tissue and abscesses which are associated with actinomyces israeli. Rarely it causes periodontitis, brain abscess, meningitis, endophthalmitis. So rarely it may cause periodontitis, brain abscess, meningitis, endophthalmitis. Next organism is Aggregatibacter afrophilus and Aggregatibacter parafrophilus. So earlier they are considered the members of Haemophilus, but now they are kept under the genus Aggregatibacter. They are also the commensals of mouth. Occasionally, they can cause endocarditis, head and neck infections, and invasive bone and joint infections. So, occasionally, they can cause endocarditis, head and neck infections, invasive bone and joint infections. Aggregatibacter Aphrophilus requires only factor X, whereas for Para-Aphrophilus, it requires only factor V. These are the things which differentiate the growth requirements between these two bacteria. Aggregatibacter Aphrophilus requires only X factor and Para-Aphrophilus requires only V factor. Next, this short form for Cardiobacterium hominis, it frequently affects the aortic valve. It is associated with arterial embolization and immune complex glomerulonephritis or arthritis. So, Cardiobacterium hominis is associated with arterial embolization or and immune complex glomerulonephritis or arthritis. Fifth organism is Eichinella corrodens, which also causes skin and soft tissue infections apart from infective endocarditis. So the name corrodens comes from the thing where it shows characteristic pitting or corroded colonies on which agar? Blood agar. And last organism is Kingella kingae. So along with endocarditis, it also causes infections of bone, joints and tendons. Lab diagnosis. First one we see is the culture. Blood cultures are taken of these bacteria by and detected using automated systems like BACT or ALERT. Why? Because they are highly fastidious, they require multiple blood cultures, and they have the prolonged incubation up to 1 week. Why the Hacek organisms are cultured in blood cultures and detected by automated systems? Why? Because they are highly fastidious, require multiple blood cultures, and they have a prolonged incubation up to 1 week. Also, they are capnophilic, meaning they produce optimum growth in 5 to 10% of carbon dioxide. Identification of organisms is done by automated systems like MALDI-TOF or Vitek. Also, we can use molecular methods for simultaneous detection of Hacek organisms directly from the clinical specimens by broad range bacterial PCR, which targets 16S rRNA gene and followed by sequencing. Also, we can use multiplex PCR and real-time PCR. Treatment. The prognosis of Hacek endocarditis is good. So the drug of choice is ceftriaxone given 2 gram per day for almost all organisms of Hacek group except Eichinella corrodens, which is generally treated with ampicillin. Quinolones are also effective for beta-lactamase producing strains. Duration for which the antibiotics given depends on the type of endocarditis. For native valve endocarditis, it is given for up to 4 weeks, and for prosthetic valve endocarditis, it is given up to 6 weeks. This is the end of Hacek